So I just got back from my pre-op appointment with my surgeon and blasted him with questions. So I figured I'd make this video as an update as to how I'm doing pre-operation. So this is 1 week pre-op. Some of the things that we talked about in my appointment were just to reassure me because I'm super scared to get the operation done. I would say they fall into 3 categories. We talked about his experience with patients and their recovery process. We talked about ways to aid recovery, and we talked about my personal situation and why that surgery was chosen for me, and long-term outcomes. So in terms of his patient experience, we went into questions on what he's seen with people he's operated on. I asked if he's ever had an amputation. His answer was yes, which is scary, but he did say that that person was a smoker, a diabetic in his 60s, and had a much worse bunion deformity. It was just really bad. He actually described it as ridiculous and ended up having to get it amputated. It doesn't seem like that's going to happen to me. He said that's very unlikely for someone. My dog is saying hi. Someone of my condition to experience that. He's never had that happen with someone in my situation. So I guess it depends on the person, basically. I asked about malunion of the bone, since the Lapidus procedure is what I'm getting, and that involves a fusion of the metatarsal. He said that in the years since he started using Lapiplasty based techniques to perform the Lapidus surgery, which has been quite a few years, I can't remember exactly how many, he has not had anyone not have a bone fusion before. That was comforting. We talked about long-term chronic pain in his patients. He said there's always a risk. For the most part, people end up pain-free. He thinks that I will be pain-free, but you can never assess everything that might happen in surgery. So that is a risk. Just have to find a doctor you trust, do your research, and make sure that you're ready to undergo the procedure, basically. So these questions made me feel a lot more confident, knowing that there are risks, but knowing where I'm at with how I might do, how the doctor thinks I'm gonna do. So that was good to talk about. So as for recovery aid, we talked about swelling. They actually have, they give you a sleeve that you put on your foot and your leg that helps with swelling, should swelling be an issue. They guide you through, in terms of toe mobility, they guide you through what to do, when to walk, when to move your toe around, so as to avoid scar tissue buildup and long-term pain. They really walk you through everything. So as I'm going through the process, I will update on what the resources are and how they walk me through it, because I think that's very important. If you're going to go through this procedure and you might not have as much support depending on the doctor, I know every doctor is different, you may have more or less support. I'm just going to fill in with these videos what is gone through, just so that you can have the best recovery possible. And it sounds like I trust my doctors. I think that they will help me through the recovery very well. So I didn't ask them about supplements, which I wanted to. So I feel like there's definitely bone health supplements that might help. I know magnesium is good for bone healing, but I will check in with them about that. As for pain goes away day 5 to 7, they said. Or not goes away completely, but like the big pain subsides around that time. Of course, there also is elevating and icing. You should definitely elevate and ice as much as possible, like 100% of the time, besides bathroom breaks for the first 2 weeks, and then like as much as possible after that. As for my personal situation, I did ask a little bit about like specifics for me. I want to go on a trip 2 weeks from my surgery date to New Hampshire. I said I would elevate and ice constantly, and they said that shouldn't be a problem at all, and that's pretty helpful. So I guess, I mean, moving around and doing some excitement is not a problem as long as you're following the healing protocol and elevating and icing. I was a little bit paranoid that I would need full support and to be at home and, you know, not go anywhere, but as long as you're following the protocol, you should be in the clear. Don't put pressure on your foot if you're not supposed to, elevate and ice, you know, all that. Another thing I asked was, why did you choose this surgery for me? So I'm getting that Lapidus surgery, as I mentioned. It has like some, Lapiplasty techniques applied to it apparently by the surgeon, since he's performed both types of surgery traditionally. Lapidus is a fusion, it's going to be a bone fusion surgery. And he said that's ideal for me since my metatarsal is very hypermobile. So it moves around a lot. If you put pressure on it, like you can just, it's gross. It's like when someone's double jointed and you're like, ew. Like you see someone like jump roping with their arms and you're like, why can you do that? Like, that's the feeling I got when they were moving my foot around. I was like, why is it so flexible? So they're gonna fix that by fusing the joint together. That is going to prevent any further, they're gonna fuse it into place, so it's gonna get rid of the bunion formation and it's gonna prevent recurrence because it's just fused into place. And then since it's at the back, it's going to limit the mobility of the metatarsal. But the toe will be able to move since it's farther up, and you can just, as long as there's not scar tissue buildup, you can move the toe and have mobility. So that's good. I basically asked, I did specific questions like, can I jump at 3 months? He said yes, so that's very specific, just to gauge when I can start doing activities. So at 3 months I should be good to go to jump and do things like that. I was like, what about deadlifting? Like very heavy weights as an extreme example. And he was like, how heavy? And I said 200 pounds. And he said, that's a bit extreme to just jump into that at 3 months, which I think makes total sense. But he was thinking about it, so that's a good sign. I'll update you with my recovery timelines as I go along in the recovery process. Another thing we talked about was who you are, I guess, influences your recovery. So who I am is I'm 24 years old, so that's pretty young. My healing will be pretty good. I don't have any allergies or medical conditions, so that's good. I do take medication, so I take an SSRI, which is a antidepressant, and I take a birth control pill. I think the SSRI is fine, but the birth control is a risk factor for blood clots. Very rare but possible, so they're gonna give me some kind of like injections as a blood thinner to prevent blood clots. Weight, I'm 110 pounds, so he said that's actually really good since I guess because there'll be less pressure on the foot once I start walking, so it's good for the healing process. If I don't gain like 50 pounds from doing nothing during recovery. So that's another factor. I'm not a smoker. Smokers actually, it's actually not very good for recovery. Apparently, I'm not going to explain why because I don't really know why. You can research it though, I'm sure. And that's pretty much it. Yeah, that's what we talked about in my procedure. In my appointment, so it was super helpful to hear all of the things. I figured I'd post it in case it's helpful to someone else out there. If you have any questions, feel free to shoot them in the comments. I'm planning on making more videos, and hopefully they'll be helpful to you.